In this video lesson, we're going to learn what peripheral neuropathy is. Well, peripheral neuropathy technically is damage to or disease affecting the nerves. Peripheral neuropathy is neuropathy of the periphery, the peripheral nerves. If you recall, the nervous system is divided into different parts or different systems. We have the central nervous system, which would be comprised of the brain and the spinal column. And then we have the peripheral nerves that come out of the spinal column that go out to the rest of the body. Most of the time when we're talking about peripheral neuropathy, we're talking about neuropathy that's affecting the feet, the legs, the arms, the hands, and in many cases will present itself in the back. So that's what we're talking about. Now, most of the time, peripheral neuropathy usually tends to start in the furthest away. So that's why often we see it start in the feet and then work its way up the legs. But that's not always the case. Sometimes you can have neuropathy, peripheral neuropathy, just in the hands or other areas, but not in the feet. It depends on what's causing, what's the mechanism that's causing the neuropathy. But most commonly, we do see it starting in the furthest periphery and then working, from there or progressing from there. Not always the case, though. Now, peripheral neuropathy is becoming a very common chronic disease. About 8 to 10% of the population in the United States currently suffers from peripheral neuropathy, and that may not seem like a lot, 10% of the population, but to put it in reference, that's 24 million people in the United States, number one. Number two, it's increasing exponentially. We see it, the number of people suffering from it going up quite a bit, quite rapidly. And thirdly, just in our own local community, within the Albuquerque community, that represents about 60,000 people. And so there's a lot of people, a lot of our friends and neighbors that are suffering from this. And so it's a big deal. It's commonly occurs in older adults. It really can occur at any age. Sometimes we see people in our center even in their 30s, but it can occur at any age, but most commonly it's in older adults. About 30% of neuropathic patients are linked to diabetes or prediabetes. That is the most common cause or contributor to peripheral neuropathy is diabetes and prediabetes. But you can see there it's only 30%. So 70% is caused by other things. We'll get to some of the most common causes here in a moment. What are the 7 most common warning signs? This is not all of the warning signs or all of the symptoms, but these are the most common. Numbness in the feet and legs, hands and arms. Very, very common, probably the most common. Not always. People with peripheral neuropathy don't always have numbness, but it is the most common. Sometimes people will experience burning pain where it feels very hot or almost on fire. Cramping is very common amongst peripheral neuropathy patients. Sharp electrical pain. We're talking about nerves. Nerves are basically electrical wires. So sometimes those symptoms present themselves as being sharp electrical shocks or pains. Prickling and tingling is very common. Balance problems and falls. That's a big deal, but it's very common amongst neuropathy patients to begin to lose their balance and feel unstable. And then often people cannot sleep because it's so painful and discomfort. There's so much discomfort. Again, these are not all the symptoms. You may have other things going on that in terms of symptoms, but these are the most common. And they are warning signs to let you know that there's something going on that maybe you need to pay attention to. And it's kind of like when you get a lamp. You've all had this experience. You get a lamp where there's a short in the cord where suddenly the lamp shuts off. You go and play with the cord, the lamp comes on. You play with the cord, eventually it goes off. You keep playing with the cord and you get it to come on and off. But eventually that cord breaks down to the point where that lamp no longer works. And the only way you're going to get it to work is to replace the cord. You could place the lamp in a different room. You could plug it into a different electrical outlet. You could replace the light bulb, but none of those solutions is going to solve the problem of the broken cord. So it's kind of like that with neuropathy, that when the cord is damaged or the nerves are damaged, you could do all these other things to manage the symptoms, but until you repair that cord, you're going to continue to have problems. And so what are the top causes of peripheral neuropathy? What are the things that can contribute to or cause? Well, like we said before, diabetes and prediabetes is the most common. About 30% of cases can be directly related to that. 50% or so, 50 to 70%, depends on which data you look at, of people who have diabetes or prediabetes will end up with neuropathy. And so it's a very, very common thing that those two go together. Poor circulation is a top cause of peripheral neuropathy. And not only is poor circulation a cause, but we're going to learn here in a little bit, it is actually one of the key solutions as well. Exposure to toxins is a very common cause of neuropathy. For example, things like chemotherapy. About 50% of chemotherapy recipients end up with peripheral neuropathy. Other toxins, like toxins in our environment, like mercury in water or lead exposure, or sometimes we see war veterans that have been exposed to war chemicals like toxic or like Agent Orange end up with peripheral neuropathy. Anything going on in the spine or the neck. You think about all the major nerves come out of the spine. And so therefore anything going on in the spine could affect the peripheral nerves downstream. So if you've got issues in the spine such as herniated discs, stenosis, degenerative disc disease, those types of things can cause or contribute to neuropathy. Or other things like injuries to the spine or compressed disc, those types of things. Surgery can actually cause neuropathy. You think surgery is supposed to help. Well, it does in many cases. However, because they're in there working on things in terms of surgery, sometimes they damage nerves that can cause peripheral neuropathy. Autoimmune diseases, infections such as viruses or bacterial infections can lead or contribute to neuropathy. Abuse of tobacco and alcohol. Other conditions for certain organs like thyroid, kidney, liver, etc., can contribute or cause neuropathy. And even over-the-counter medications and pharmaceutical medications, although intending to help, sometimes the side effects are that they can cause or contribute to peripheral neuropathy. Now, with that last point, one thing I will say in relation to that, because so many people are on them, are statin drugs. Statins are notorious for contributing to or causing neuropathy or creating or exacerbating those conditions of neuropathy. And many physicians don't necessarily know that. So it's important to understand and to be educated and informed that if you're on a statin, that statins are not good for neuropathy patients. We are not advocates. We're not going to be the ones telling you not to use any of your medications. We just want you to be informed of some of the effects. Now let's dig in a little bit deeper on nerves. And so what you see here are representations of nerves. You see here, first of all, that we have the nerve itself. Looks like a little wire sticking out. We have a insulation sheath around that nerve called the myelin sheath. And so these are representations of nerves, and different nerves have different jobs. It's really amazing how the body works. And so when we look at these, what we call the large nerves, these large nerves are responsible for things like balance and giving the information to the brain about our position and that type of thing. So for example, when somebody is walking, the nerves, these types of nerves will actually vibrate every time that their foot strikes the ground, so that it sends signals to the brain to let the brain know that the foot struck the ground, and therefore the brain can help make sure that you're walking smoothly and you have stability and confidence. Well, if these nerves are damaged, what might be some of the things you could experience? Yes, exactly. You could have problems with balance. You could feel unstable. You could have problems with falling. You could have problems with lifting your foot, at the appropriate time or the appropriate height to get over things like a small step or a curb or something like that. And so you can see that that could be a big deal. And it can be a big deal because falls are very serious business, especially as we get older. 1 out of 3 adults fall each year if you're over 65 years old. 20 to 30% of those falls end up in moderate to severe injury, and 10% are fatal. We all know that the leading cause of death for people over 65 is falling. So this is a very serious issue. If the nerves are not functioning well so that you feel stable and you have good balance, then neuropathy can cause balance issues and falling and can cause some very serious situations, not to mention the loss of independence and the loss of mobility. Now, let's dig a little bit closer on some other nerves. These are what we call the small nerves, and we're not going to talk about all these nerves here. Just want to give you some examples of different types of nerves and their jobs, and if those nerves are damaged, some of the effects. So these small nerves are responsible for some things like sharp stabbing sensations, temperature sensations, things like that, hot, cold, etc. So if these are nerves that are damaged, what might be some of the things you could experience? Exactly, that's when you might feel some of the numbness or the tingling, or because of the numbness, you may not feel a sharp stabbing pain when, for example, you step on something sharp because of that numbness. Just to give you an example, we have seen patients that have stepped on things like broken glass in their kitchen, not realized that they've stepped on broken glass. They receive an injury or a puncture and don't even realize it, and therefore that can become infected very easily because of that unawareness. They don't take care of the injury. Worst case scenario, we've actually seen a patient that glass has become lodged in her foot, and she not realized that for quite some time until the entire foot becomes infected. So it's a really, really big issue. We've had patients that can't sense temperature differences. For example, they draw a hot bath of water. They don't realize how hot it is when they put their feet in it, and therefore it can actually cause some skin damage because they can't feel those temperature differences. So those are the types of things that you may experience by these nerves not functioning correctly or having neuropathic damage to these types of nerves. And that's a big deal because eventually, and this is worst case scenario, but worst case scenario is that can lead to amputation. And so there's two things that you need to realize about this. One is the fact that because you may not have the sensation to realize that there's been a puncture or a injury or a cut or a blister or something like that, those things can become infected, which the infection could lead to amputation. But the other thing you have to realize is the fact that when nerves die off completely, then the tissue around them begins to die, and that leads to the fact that that tissue needs to be removed. And that's why we see amputations in many diabetic patients. But it's not limited to just diabetes patients. It's limited to anybody, it's really applies to anybody with neuropathy. This is worst case. Not everybody with neuropathy is going to end up with an amputation. I want to make that very clear. But it is a possibility and something that you really need to be aware of and making sure you're managing well. Now, here's an illustration of a nerve. This is a little more technical drawing of a nerve. We can see here on the left that this is a healthy nerve cell. We see the nerve cell body, and then we see what's called the axon. The axon is basically that wire that the nerve signal is traveling down. And when that is healthy, then things are fantastic. It's transmitting the information the way it's supposed to, and we're functioning well. Problem is when that nerve cell gets damaged or when the axon gets damaged, as you can see in the right, that it doesn't work well, that it doesn't send the right signals, and therefore that's when we have symptoms of things like numbness, tingling, cramping. That's when we have problems with balance, and it causes all kinds of problems and pain and suffering so that we can't sleep. So, this is just an illustration of a healthy nerve versus a diseased nerve and technically what that looks like. And the thing to realize is that neuropathy is progressive always. Now, it always gets worse. Sometimes it will be a very slow progression. People can go years with a very slow progression where it's almost imperceptible. Sometimes, though, it's very, very fast and very rapid in terms of its progression. Sometimes the neuropathy symptoms will present themselves and sometimes they go away and it'll come and go. But usually what happens in that progression is that the symptoms become more and more frequent, they become more and more persistent, they become more and more pronounced to the point where they eventually get where they're present and consistent all the time. How fast that goes or how slow that goes, there is no way to predict. But just know that if you do absolutely nothing, at some point, it's going to get to the point where it's going to be persistent, frequent, and very, very serious. Now, here's some good news relative to all this. The National Institute of Health says that peripheral nerves, once they're damaged, they can be regenerated as long as the underlying nerve cell has not been killed off. Now, there's two stories in that. One is that if the nerve cell is dead or we've let it progress too far, there truly is nothing that we can do. It is too late. But if it hasn't progressed to that point, there is great news in that we can regenerate nerves with the right application of right treatment and the right modalities. So great news. Well, when should you take action? Well, this is just a little bit different illustration of the same type of information in that what we see here on the top here is a normal, healthy nerve. There's the nerve right there, the little wire. There's the insulation around it. And what do you think these red lines represent? That is correct. That represents the blood flow, the capillaries that are delivering oxygen and nutrients to that nerve. What do you notice is the difference between that nerve that's very healthy and the second nerve that we see here? Correct. You can see that there's a lot less blood flow. And because of that loss of blood flow, we see nerve damage. We see degeneration in that insulation sheath, the myelin sheath, so that we're not getting the right signals traveling up and down that nerve, and therefore we're experiencing symptoms of numbness, tingling, cramping, etc. What do you notice about that final nerve? Yes, that is a nerve that has progressed too far. The nerve cell is dead, and there really is nothing that we can do. So when is the best time to take action? Well, like all medical situations, the best time to take action is sooner than later, because sometimes we let things go too far and then nothing can be done. Or we let them go so far that we're limited in what we can do or how much results we're going to get. So your best chance, the most likelihood of getting good results is to address the situation sooner than later. Well, again, just to remind you, what do we expect of our patients at our clinic? We expect from our patients that they're going to have an open mind, that they're going to be willing to learn something, and they're going to be willing to act. So with the information that I've just provided to you, we invite you to, based on what you've just learned, we invite you to act. Only through acting can you expect anything to change. So now knowing what you know about neuropathy, and maybe you need to evaluate based on the information that you now know, how does that apply to you? How does that apply to the things that you're experiencing? Is it consistent with what you're experiencing? And if it is, we would invite you to act. First action that I'm going to ask you is to continue finishing these lessons, because in the next lesson, we're going to talk about part of the problem being how traditionally in medicine we've approached and tried to treat neuropathy. And so it'll give you really good insight on what has not worked, which then will lead into, well, what can work? What can we offer in terms of some real solutions? So first item of action is to continue watching and continue learning, and then, as always, continue to act. We'll see you in the next video lesson.